This is a video in clinical medicine from the New England Journal of Medicine.
The ability to obtain peripheral intravenous access is an essential skill for all physicians. Although considered one of the simplest invasive procedures, mastering this potentially life-saving intervention requires refined skills and experience. Cannulating a vein, particularly a small one, can be challenging. The purpose of this video is to demonstrate how to access peripheral veins using an intravenous catheter. Peripheral intravenous catheterization is required in a broad range of clinical applications, including intravenous drug administration, for intravenous hydration, transfusions of blood or blood components, during surgery, during emergency care, and in other situations in which direct access to the bloodstream is needed. Relative contraindications to inserting a peripheral catheter in a specific site may include infection, phlebitis, sclerosed veins, previous intravenous infiltration, burns or traumatic injury proximal to the insertion site, arteriovenous fistula in an extremity, and surgical procedures affecting an extremity. Other situations may preclude obtaining peripheral intravenous access. For instance, extreme dehydration or shock may render cannulating collapsed peripheral veins impossible. Some patients may lack suitable peripheral veins because of prior chemotherapy or intravenous substance abuse. When access to peripheral veins is impossible, and in other situations in which accessing peripheral veins may take too long, insertion of a central venous or intraosseous catheter or peripheral venous cut-down may be required. A detailed understanding of the venous system of the upper and lower extremities will facilitate successful cannulation. The upper extremities have two primary venous systems: the cephalic vein, traveling on the radial side of the forearm, and the basilic vein, originating from the ulnar side of the forearm. Although venous anatomy may vary considerably from patient to patient, these two systems generally remain distinct, other than communicating at the antecubital fossa and the wrist. However, be careful to avoid inadvertently cannulating the brachial artery, which usually lies just medial to the median cubital vein. The same applies for the radial and ulnar arteries at the level of the wrist. Use careful palpation to identify arterial pulsations to minimize the possibility of this complication. The venous system of the lower extremities consists of the greater and lesser saphenous vein, cannulated in acute situations, as it accommodates large bore catheters and may be easier to cannulate. When upper extremity veins are inaccessible, the dorsal veins of the foot or the saphenous veins of the lower extremity may be used. Cannulation of lower extremity veins is associated with a higher incidence of thrombosis and embolism as compared with upper extremity veins. This risk is lower in children and infants. Therefore, the veins of the legs and feet are an acceptable alternative when cannulation of the upper extremities has failed. Other alternative intravenous cannulation sites include scalp veins, used in neonates and young infants, and the external jugular vein. Gather the equipment and have it ready at the bedside before beginning the procedure. You will need gloves, eye protection, a non-latex tourniquet, chlorhexidine-based antiseptic solution, sterile 2x2 gauze, a saline flush, a transparent occlusive dressing and tape, and appropriately sized catheter ranging from 14 to 24 gauge, an intravenous fluid bag with tubing, and a sharps container. A local or topical anesthetic may be required if the catheter is 20 gauge or greater. There are many catheters varying in style, length, and safety mechanisms. The two most common types of catheters are the over-the-needle catheter and the winged butterfly catheter. The butterfly catheter comes with attached tubing, whereas the over-the-needle catheter does not. For both catheters, the steel inner needle is removed, leaving only the plastic cannula in the vein. Different safety mechanisms have been developed to minimize the possibility of inadvertent needle sticks. Some catheters are equipped with a spring-activated retractable needle. Others have a protective clip that covers the needle as it is withdrawn from the plastic cannula. Needles should always be discarded appropriately in a sharps container. The size of the catheter selected will depend on the clinical situation. The smallest effective catheter should be used because small catheters allow for less resistance to blood flow around the cannula and are associated with fewer complications. Large catheters, such as 14 and 16 gauge, are used in acute situations for fluid resuscitation. For example, in managing hypovolemia in a trauma patient or in a patient with severe dehydration. Other factors that may influence the size of the catheter used include age-related vessel size, the need for pressurized boluses for administration of contrast or medication, and the viscosity of the fluid to be infused. Explain the procedure to the patient and address any specific questions or concerns. Discuss potential complications such as bleeding, bruising, and infection. You must follow standard precautions when placing a peripheral venous catheter. This includes washing hands, wearing gloves, and using eye protection because of the risk of blood splatter. When the selected site is in an upper extremity, the patient should be placed in the supine position with the arm supported. A comfortable position for the practitioner and proper lighting are important for successful intravenous cannulation. Tie the tourniquet with a half knot 8 to 10 centimeters above the targeted insertion site. Place the tourniquet flat against the skin and bring the tourniquet ends together, overlapping one another. Stretch the ends of the tourniquet and with one finger, tuck the top tail beneath the bottom, directing the end away from the puncture site. When evaluating a vein for cannulation, inspect and palpate the available veins. Gently tilt the extremity or adjust the angle of the light to reveal better the contours of the vessel. To palpate a vein, place 1 or 2 fingertips over the selected vein and gently apply pressure. Release the pressure to watch and feel the refilling rebound of the vein. An ideal vein feels round, firm, flexible, and full.